So the first question goes to Dr. Lenhardt. Do you have a particular view on the pathology of ME/CFS and fibromyalgia, or do you have any particular treatments for ME/CFS and fibromyalgia? I think you kind of covered that a little bit, that it's always patient specific according to a lot of things, but.
Yeah, so I'll just give a summary to, I guess, reinforce what my approach would be. So if somebody came in, I'm blessed now that I have a small group of patients and I have 60 minutes minimum, so I can do a full intake and spend much time. But so I take them through the process like Sharon was describing, and I think everybody needs to have the basic approach. I mean, hey, sometimes somebody comes in and you do the basic labs and you hit something and right off, so there's almost like layers to it. So we start with the basic approach, which is fine. And one of my goals of staying in the system is to get as much covered by insurance as I possibly can, because I know how expensive functional naturopathic integrative, it's nothing nefarious, but just the way it is, so I stay in the belly of the beast to try to get as much covered as I can. So then I'll do my functional approach and do a sort of another round of testing. It's like concentric circles coming out, and then potentially if we're left with ME/CFS, meaning, but as Sharon alluded to this, it is a slow, patient, methodical process that takes 3 months, 6 months, a year to really go through, because there are so many different underlying causes and contributors that are really so different from person to person. It really takes so one of the things I've been working on, and you mentioned in the introduction, so for over 10 years, I've been working on a system called RootFinder that uses algorithms. So out of 30, I think we're at 30 or 31 root causes, the system will make predictions regarding the most likely top 5 causes for each person. And so that makes the process much more efficient for me. So that's included in the root causes that are predicted is fungal overgrowth, mold toxin illness, mast cell activation, oxalates, limbic system dysfunction, low thyroid, low cortisol, mineral deficiencies, tick-borne disease, so the algorithms are always being adapted, expanded, verified. We're adding root causes to try to make the system more useful, but that makes the process much more efficient in my experience. And that was the goal. The goal of the system is, if the system predicts to the top 5, it's much more likely that that is an active problem and the person will feel better, which ultimately is the most important thing, if we address it. And if it's not in the top 5, it's less likely. But of course, it's subject to interpretation from an experienced provider. But in terms of the pathophysiology of ME/CFS, if you had asked me that question 6 months or a year ago, I probably would have given you a very different answer. I probably would have focused on the viruses and cell danger response and leaky gut and systemic inflammatory processes. And again, heavy metal toxicity, there's just so many things that can be contributing. But long haul COVID is in a good way has blown it all up. And now this new paradigm of microclots and inflammation and arterial, disease with microclots and hypercoagulability is, I would be surprised if it didn't shift so I'm starting to do a series of labs. I have my own set of 5 or 6 labs that I started to do for people: von Willebrand's antigen, D-dimer, fibrinogen. So I have my own based on the researcher Pretorius Patterson, Ann Corson, who many of you might know, and others. So I'm doing my own profile, and I have maybe 5 or 6 people on regimens who meet criteria for ME/CFS with or without fibromyalgia. So I'm just jumping in there, and as long as I think it's safe. I'm not using a Pixaban because I think that's a bit dicey for me to start using blood thinners on people, but I have a couple people on Maraviroc with statins, and I'm using, Ann Corson really recommends different systemic enzyme therapies, serapeptase, lumbrokinase, nattokinase. So I'm starting to work, trying to take the best of all three of them and put together as best I can. So that it's going to be very interesting even to see what happens in my group for the next 3 to 6 months, see how this plays out. So long answer. Sorry about that.
Exciting. No, thank you. That was very informative. And one person asked if you have any experience with post-exertional malaise or professional working experience with post-exertional malaise, which is, really the distinguishing factor for ME/CFS. And, is there anything that can help with that or any kind of treatment?
Well, that's an interesting one, because if you asked a naturopath or a functional person, especially a naturopath, but if you asked them that question, most of the last 25 years, they would have said the person had an adrenal issue, adrenal fatigue, that would be one of the most reliable. And that's what I said for years, again, because I'm always trying to learn from whoever I can learn from. That was like the classic, most reliable indicator of adrenal fatigue and low cortisol states was post-exertional malaise. So what we often see is we'll have this end point, post-exertional malaise, and depending on the person's background, experience, or perspective, they will think about it and interpret it and in a very different way. So some people say, well, absolutely, that's ME/CFS. Other people say, no, that's adrenal. Other people say, but I think that is one piece that could have many potential causes and contributors. And it goes right back around that everybody needs to have a thorough, comprehensive, methodical process, as efficient as possible. You can't really rush it. I mean, sometimes you pick up things early, but that really the goal would be to get everybody through, exploring anything and everything to see what shows up.
Yeah. There were a couple of questions about mold being a contributor to these things. And I know working with the Lyme community, that comes up in so many of my patients too. I'm obviously a mental health provider, so I have no take on that, but I'm curious what you have to say about that.
Major blockbuster bonanza issue. However, well, there are not that many people that are versed in it, so it's very, very hard. The only certified person is the woman in southern New Hampshire who's certified through Shoemaker. But of course, there's the Shoemaker group, and then there's the Brewer group, and then you have Neil Nathan in the middle trying to sort it out. And so that's the hard thing, is these are all very complicated subjects, and you're going to get very different opinions and approaches. When I talk to people about mold, I say, okay, you can have four potential problems with mold, and you could have any combination of these. You could have mold allergy, you could have mold infection and overgrowth, which Shoemaker dismisses, but plenty of other people think is real. You could have mold toxin illness, so-called chronic inflammatory response syndrome, which is, some people in the traditional world say, oh, mold, there's no research behind that, there's no evidence, and they have no idea apparently what Shoemaker's like, because he's been doing this work for 20 years. A lot of really smart people in on this for a long time. And Shoemaker is an absolute fanatic about research and evidence, and just intolerant of anything that is not science or research based. Everything else is fluffy nonsense to him. So we have allergy, we have infection and overgrowth, we have mold toxin illness, and we have oxalates. So fungal species can make oxalates, oxalates can build up in tissue. Here's one thing I'll say as somebody who's pretty experienced in medicine and fairly experienced in functional medicine, integrative medicine. There are so many times but I'm reading, learning, doing everything I can to understand something. And I think, okay, this is beautiful. This is it. I'm going to be able to help so many more people now that I understand this. Well, actually, what normally happens is the first person I manage does well. I said this to a patient this week, and she said, well, maybe you're so enthusiastic that it's placebo effect. And I said, yeah, I don't know, but I see that over and over again. So the first person does really well, whatever it may be. It could be oxalates, mast cell activation, bold toxin, whatever.
Yeah.
And then reality sets in, and you realize, it's so complicated. It has to be done in a certain order, and the testing is expensive. And I don't want to recommend $300, $400, $500, $700 worth of tests. I feel responsible. Like, I'm not going to just say, well, you know what, you better be interested in your health or else not my problem. Like, I'm never like that. So it's just, it's hard work, and it's gratifying work. And when it goes well, it's the greatest thing of all, because you help people that are very frustrated and struggling. But there's some piece of this. And again, I'm an optimistic person. I hope the long haul COVID is going to provide it, but there's some piece or pieces that are elusive, and it's very hard. Like, so many times I thought we were home free and we weren't. But another long answer. Sorry, I can't be brief. I don't know. So
I know they're complicated answers too.
yeah, sorry.
And we have a lot more questions, so I'm just going to pick out a couple. I'm sorry we can't get through them all today. But I can't imagine going to my primary care and asking them about mold and them just looking at me like I have 10 heads. And we've gotten a lot of questions about, where to find a functional medicine doctor in Maine, a functional medicine doctor in other, I think in around the DC area. And it's just like, it's really frustrating that, to those of us like myself and others here today are now learning about how great functional medicine can be and how many insights it can lead to, that most doctors are not aware of it at all. And what do you think is needed to bridge that gap in functional medicine and traditional medicine?
Yeah, it's a tricky one. I mean, what's gone on with the naturopaths in the last 30 years since the 70s is very interesting. Again, okay, I won't tell the whole story because that'd be another 5 minutes. But they were on the edge of being extinct. There was like one school, I think it was probably Bastyr, they graduated one student in like 1974, and the naturopaths resurrected it, saved it. And now there are more and more states where naturopaths can be primary care physicians, and the insurance company has to pay them for their services. So for us to bridge the gap, I think the naturopaths have been doing this work for 25, 30 years, trying to get credibility, trying to get the insurance to cover them. It can't be private pay. I mean, functional medicine is too expensive, too complicated. The new people into functional medicine, again, I say this but are often over managing things. They're picking out they're in the weeds, managing every little abnormality. Well, this is down to, this is high normal, that's low normal. And they're putting people on 7 to 10 supplements for 14 different things because they don't have context, they don't have clinical background. So really what would make the biggest difference is if insurance covered functional, integrative, naturopathic providers as primary care physicians, and covered the testing. One of my 100 dreams, which I probably will never pull off, is to do a study showing how cost effective it can be. In my first book that I wrote, and I'm almost done, there was this amazing study, and I'm gonna try to get the gist of it. In the Pacific Northwest, which is the epicenter of naturopathic medicine in the world, by my understanding, they did this study where they took a groups of patients, and I don't remember the number, but over time, they had some of the groups patients managed by MDs and some of the groups managed by naturopaths. So by every quality of care measure that they could think of, the patients being managed by naturopaths did better in every measure: patient satisfaction, clinical outcomes, admissions to the hospital. So the naturopaths were superior to the MDs in every measure, and at 10% of the cost.
Wow.
So if that's true, if that is representative of what would happen, if the MDs knew about it, they would lose their mind. I mean, it would be, I don't know what it would be like. I don't know what they would do. I don't
Now, is
know
that
what the regular MDs would do.
the fraction of the cost? Was that the fraction of the cost of what patients paid, or just the cost of the treatment itself?
The cost of everything. Yeah, sort of the
Because
whole thing.
patients end up spending so much because it's not covered, but actually the treatment of everything is a lot cheaper, right? Is that, I mean, like,
Yeah, because they fixed people, and because the
yeah.
herbs cost more than an echocardiogram and an MRI and a CAT scan and
Right.
surgery
They're
and
not
all that stuff. And
Yeah,
Sharon, you had
yeah.
something to say?
Yes, I think you were right. And I mean, I applaud you for trying to help patients under insurance coverage. In Washington State and in Vermont, I know that naturopathic and functional medicine care is reimbursed by insurance. You know, and some of the tests are, some of the tests aren't. I mean, I have been prescribed drugs, you know, conventional things by functional medicine providers, including naturopathic doctors. I really wish more states like Massachusetts would, you know, really open up and allow more of these practitioners to practice. I really wish the insurance companies would cover more. But I think there's got to be also a groundswell of patients demanding it. And I think your idea to have a study showing how effective it is would be very worthwhile.
Yeah, it's going to need to be proven to them. Yeah, the MDs, you know, not saying it's a bad thing. They like you can't just tell me that something sounds nice. You gotta prove it to me.
But I have been to several conferences now where I have seen MDs who, you know, like you, have seen that they wanted to help patients more and got into functional medicine. And then the stories they tell have just been amazing. So, you know, I know you're not alone, and I've just been thrilled to see more people getting involved with it.
Well, and almost, by my understanding, almost everybody that goes into functional medicine from the MD side, it's because there's something personal. Mark Hyman was sick, nobody could help him. Teitelbaum, you know, one after the other, after the other, after the other. I bet you if you surveyed 100 functional MDs or NPs or whoever, DOs, chiropractors, you know, why did you go off and do extra work? I mean, it's much more complicated, much more difficult. I mean, regular primary care is a cakewalk compared to it. Not that I would give it up. Of course, I love the work, but it's a lot more work, a lot more time. But I bet you, my guess is that over 90% of people would have some personal story of somebody, either them or somebody they knew, that was not served, like your Sharon, like your experience, you know, and you're trying to find the best of both worlds, like most people would. And so.
It's true. And I also, my life was saved. I healed from a really bad chronic illness myself through functional medicine. So I really appreciate you, Dr. Lenhardt. And Sharon, you know, you're amazing as well. There were a couple of questions for you. One was somebody wanted to know if you're comfortable sharing the alternative to Mestinon that you had mentioned. It's
a supplement. I use the Source Naturals brand, but there are other brands. And it's called Huperzine A, HUPERZINE, capital A. And it has basically the same mechanism as Mestinon, but for me, it doesn't have the allergens Mestinon did.
Okay.
And I have, you know, less side effects than when I tried to get it compounded, which you can't compound it anymore.
And what states, this is my question, what states did you say actually cover the functional medicine?
My family's gotten it covered in Washington State and Vermont. There may be other states. I think California is fairly progressive.
Yeah. Well,
I think my last count, it was like 15, 16, 17 states. Like that's I went to a naturopath conference like 7 or 8 years ago, 240 naturopaths and me. I was the only MD there. You know, it's funny. I went up to the organizer. I said, "How many MDs are at the conference?" He says, "1." I said, "Oh, okay, that's me." But that was a big. They were really talking about that, you know, political grassroots kind of movement, and they're keeping track. And I could be wrong, but I think it's like 15, 16, 17 states from zero. And Massachusetts is going to be one of the last. I mean, New Hampshire, Vermont, Maine, obviously the many more integrative practitioners, naturopathic practitioners take up residence in those places because Massachusetts is hyper traditional. And, you know, when I say belly of the beast, I mean, that's part of it, that I think Massachusetts will be one of the last, you know.
Yeah, I was impressed that I think there was a bill passed for coverage of private insurance coverage of chiropractors and acupuncture, which is maybe like a small step, but
No, it's a good analogy. You're right.
yeah, I mean,
Of course.
I remember sitting on the hearing for that, and I really hope that we can, I mean, I'm happy to get involved more in the advocacy because it's definitely huge, and it would help this population so much, many populations, I think. So just a last question, and this maybe goes for both of you, and another one that I'm really interested in is what you have to say, you know, about mental health. I mean, Sharon, you living through this has got to be, I mean, and caring for loved ones that are living through this has got to be so challenging in so many levels. And, you know, we want to know, like, do you have any suggestions for coping with that? And how what has helped you get through all of this?
Well, I'm a big fan of mindfulness. You know, there are
Yeah.
mindfulness programs, et cetera. You know, getting as much exercise as I am capable of. You know, just I look at this as a marathon, and you know, I'm not going to win the race on any particular day,
Mhm.
but just keeping myself in as best shape that I can throughout this. The other thing I've learned mentally is I have experienced depression, anxiety, you know, just feeling off, lethargy. And what I've really learned over time is that it's biochemical for me most of the time. So I report my symptoms to my functional medicine doctor, and that's actually how I found this Kuvan drug, because I was very low in dopamine, and this BH4, which is the chemical substance that Kuvan is an essential cofactor for making neurotransmitters. It's also essential for many other body processes. So that, you know, so that, like things like folate, B12, but getting, you know, dialing in and getting that right, and, you know, just making mid-course corrections by reporting symptoms to my providers has been tremendous. And the same thing happened with my daughter. And so that's how I knew to look at biochemistry.
Yeah, wow, interesting. Dr. Lenhardt, do you have any words about the whole mental health or even
Yeah. I used to say that among the medical specialties, there was a 10-way tie for last. Then I said, psychiatry has that position all by itself because they don't even do any testing. I mean, there is no colonoscopy, there is no chest x-ray.
Mhm.
Nobody gets any testing at all.
No, I
Talk
know.
about a discipline that's based on trying to lump people together with a diagnosis and then manage them in a similar fashion. But so, like everything else, and I have to I have to remind myself of this all the time. We always want to start with the foundation and then work up from there. So we wouldn't want to do, you know, $1,000 worth of tests and do exotic things and put people on 7 supplements and 3 meds. If the basics of relationships, sleep, diet, gut health, being outside, mindfulness. So everybody, no matter what their issues, in my view, has to make sure the foundation's in order. Because if you're stressed and you can't sleep and your diet's horrible and you're staring at a screen all day and you're cooped up and you have anger and resentment and you have problems with relationships in your life, well, what's a supplement or what's organic acid profile going to show us? I mean, so for everything, including mental health, we start with the foundation. I used to say And exercise was the number one antidepressant, especially based on the antidepressant trials that have never been published. And that might be true, but of course that's can be insensitive to say. I would never say it to somebody who's tired and they're like, what are you talking about? But
Yeah.
so that, but and then I would say beyond the foundation, it really has to be individualized. Like Sharon did well because she had low dopamine. Well, some people are in low dopamine state, some people in high dopamine state, some people low serotonin, high serotonin. Some people do really well with methylated B vitamins. Some people do worse.
Mhm.
So the idea be like, you can just say, well, let's just give everyone B vitamins, or let's just give, I'm not saying you were saying that, I'm saying, let's just do this or let's do that. I mean, that's the goal of the functional integrated naturopathic paradigm, is to individualize treatment as much as possible beyond the foundation. So I think, which is more complicated, takes more time, and requires a completely different training background, which is part of why it never happens or it doesn't happen too often.
Yeah. Well,
But we are all individuals with individual genetics and environmental factors. So it makes sense to individualize medicine and treat us as individuals and, not as carbon copies of one another. And I think that's been the problem with like evidence-based trials, because people are not widgets. And so the doctors, one thing that hasn't been said enough here is having a doctor be able to spend 30 or 45 or 60 minutes with you is just a gift, because they can learn so much about you. And, if they have the algorithm you've got, Dr. Lenhardt, that's fabulous. But, I've dealt with people who have the experience to be able to zoom in on different problems just by getting to know the patient. And that's so critical, which it just doesn't happen enough in allopathic medicine.
Thanks so much. Well, this was so informative. A lot to take in, but really incredible. And I'm probably gonna have to watch this again once it's up on the website. Thank you, Sharon, for sharing your experience. And thank you so much, Dr. Lenhardt, for sharing all your experience and all that information. We are now coming to the end of today's session. This recording will be shared on the Mass MECFS YouTube channel in a few days, so watch for the email about that. The topic for our Sunday conversation in April is working with your healthcare provider. The date is April 24th at 4 p.m. Eastern Time. This is the last Sunday in April, a week later than usual, so as not to interfere with those who may be celebrating the Easter holiday. The featured speaker is Dr. Alba Azola, a physical and rehabilitation specialist at Johns Hopkins University School of Medicine, who also works in a long COVID clinic. Those of you who saw the January presentation have already met Dr. Azola. This is a large topic and a complex one, so please join us. If you have ideas for future programs or speakers, please email events@massmecfs.org. Sunday Conversations is not intended to be a series of research presentations, but rather programs that will provide a variety of practical information that patients and families need and want. If you would like to join the Sunday Conversations team, please email volunteer@massmecfs.org. We are working on the fall schedule now, so please let us know. Finally, if you have found this program worthwhile, there are a few ways you can help. You may make a donation to help support this series by donating online at massmecfs.org/donate. On the same page, you can sign up for our newsletter. And if you donate $25 or more and check to become a member option, that will establish or renew your membership, and you will be invited to our members only programs. Thank you all for coming, and we hope to see you again next month.